Welcome to the RCM Ladder. We dive into career development and growth for revenue cycle professionals, helping you level up your career one episode at a time. This episode of the RCM Ladder is brought to you by our good friends at the Health Exchange. Welcome to
an awesome
the RCM Ladder.
Revenue cycle professionals.
We dive into
knowledge,
development,
insight,
growth
and
for
revenue
resources
cycle
needed
professionals
to
navigate the ever-changing
helping you
landscape
level
of
up your
healthcare
career
reimbursement.
one
The
episode
team at
at
the
a
Health
time.
Exchange have awesome content and events tackling everything from denials management to revenue integrity, patient access, and the importance of leveraging RPA or AI in your operations. The content is so useful, so smart, so impressive, so collaborative. Honestly, it makes us jealous. So go check them out now, right now, and then come back to us. You can find them at healthexchange.io. That's HEALTHXCHANGE.io. And now on to this week's discussion. Hello, and welcome back to the RCM Ladder. I am James Furbush, your host as always. And with me today, the one and only Laura Kern. She is the Director of Patient Access at the University of Toledo Medical Center. Laura, thanks so much for joining the show today.
Thanks for having me. Hello, everyone out there.
Yeah, so I'd love to start, just give people listening at home a little bit of context about what you do for University of Toledo Medical Center and just a little bit more about University of Toledo Medical Center, because I think one of the challenges in healthcare is every organization is so unique in their makeup and how they function. So I'd love to just hear a little bit more about what makes your organization unique.
Absolutely. Thanks, James. So first, Toledo is located in Northwest Ohio. So we're really close to the Michigan border and a stone's throw to Indiana as well. So we have some uniqueness in pulling in patients across state lines. So the University of Toledo Medical Center is an academic health system. So we have lots of learners on our campus. So many of you probably listening are familiar with either currently or previously working within an academic affiliation with learners in your space, which is a great opportunity. And there's a general air and a culture of learning academia, which is neat and brings something special to the campus. So I am the patient access director here. So patient access for UTMC includes your standard registration point of service, whether it be you're admitting outpatient clinics, outpatient hospital services, your emergency department. It also includes departments such as prior authorizations and financial counseling. We also have a 24/7 access center, which I know a lot of health systems are either discussing or moving towards, looking at not only scheduling, but pre-registration and offering lots and lots of access, which is a huge topic across revenue cycle, in particular patient access. So I'm sure you've had conversations with folks about that in the past. It also includes some housekeeping operational responsibilities around switchboard operators and general communication and access into our health system. As an example, wayfinding in most healthcare institutions is a major topic. It's not easy to navigate not only the campus, but sometimes the buildings of hospitals. So I play key roles in those areas as well. We are a standalone hospital. So for better or worse, sometimes when you work at a standalone versus a health system, you wear many hats. So sometimes I have a diverse background due to that, which is nice. I consider it as an advantage personally.
Yeah, I think it keeps things a little bit fresh if you have to juggle different hats on any given day. The wayfinding thing is interesting, just as someone who has gotten lost in numerous hospitals, always there's like, where am I going to come out?
It's easy to turn around, right? Even if you know you're north, south, east, and west, once you get into a hospital and go down a couple hallways, it's gone. I don't know where I am.
Yeah, that's true. So Laura, one of the things for this, which I thought was interesting that you said when we were initially talking, is that your current obsession right now is with succession planning and developing your bench as one of your top priorities. And I'm very curious to really unpack that as a sort of topic related to the larger umbrella of like career development and just career growth. So talk to us a second, like why is succession planning and developing your bench. Like, why is that your kind of big obsession right now within your overall career?
I would say it really started during the pandemic globally, not just in healthcare. Staffing and vacancies, finding talent was a major barrier for everyone, right? Everyone was in that boat. So we're living in a different climate. And we're also seeing a new mentality in the workforce where there's different priorities of staff and leaders, frankly, across the board. So I quickly realized that I needed to change things up. I needed to look at things differently. So I started my journey with the succession planning and looking at how I had my team built and how do I create levels wherein I have opportunities to pull from my bench for promotion. So that's what I started with, and really breaking that down and what that could potentially look like. Now, I looked at some different models. If you look across revenue cycle and not just patient access specifically, I think there's opportunities there across revenue cycle silos. Maybe not, that's not the greatest term, but within patient access, what I could control is taking first that manager position and really rethinking that, right? And thinking about which departments within patient access maybe feed each other or closely align with workflows. So grouping those areas together under one management team and then developing more supervisors underneath that. So just my general structure as director, I have a level of managers, supervisors, and then I also have team leads. We are a unionized shop here at UTMC. So those team leads, they do hold some leadership type responsibilities while being union members. So I felt as though we weren't even starting at the very beginning, we were not leveraging those team leads as well as we could have. So I developed a new manager role. So taking the old manager that was very siloed, you were a manager of the emergencies part, you were a manager of point of service registration, and making it more holistic, right? And looking at, man, those inpatient authorization and admitting folks, a lot of times are interacting because most people admits come from your ER, right? So maybe those two groups should really be linked arm in arm because one department is feeding the other. And it should be under one leadership structure that can take a step back and see the forest through the trees and make some decisions on fees, education, quality, how we can partner with those two departments. And also getting very down to the base of it, an emergency department registrar could be viewed as a very entry-level type role. So if you're a leader growing an employee that's in the emergency department to maybe then take the career transition someday into a more advanced role where you're dealing with admitting and authorizations for an inpatient stay, it goes hand in hand. And then developing more supervisory roles. So maybe having more limited managers and expanding more of that supervisory role, allowing that manager to start developing that higher skill set wherein they're creating a strategy for their areas. And then the supervisors being more in the weeds and knowing the day-to-day workflow as part of their daily responsibilities is what I started looking at. So as I started developing this concept and building out job descriptions and what the requirements would be, what the expectations would be, and how would that differ from where we are current state, it was a lot of brainstorming. It was a lot of conversations with my amazing HR partners to see where that would take me. And of course, engaging with other revenue cycle leaders, which was fun and interesting. What are you doing, Laura? Tell me more about this. And so as you talk through these kind of concepts with your peers, or even in my case, when I was reviewing it, not only with my senior leader that I report to, but senior leadership in HR, and you start peeling back really the details of what that would look like, those creative juices start going, right? Not only for myself, your peers and those you report to, and it starts becoming a more full picture. And that was, I think that was about 2 years ago. This summer will be 2 years that I rolled out that new structure. And since then, it's been an evolution to continue that growth and kind of setting expectations. So we went live with a new EMR. I have to remember the date. It's a little over a year and a half now. So amidst that, so we had the change to our structure and having a succession plan, resetting expectations for my management team, bringing in supervisors, and then we went through an EMR go live, which I'm sure many out there can imagine was huge. And so even now today, continuing to think about, because the EMR impacts so much of our daily lives and our operations, how that impacts these roles and that succession planning even more. And how does today look differently than our legacy systems? And do we have to adjust some of the roles? So even just recently, I tasked my management team to do an analysis, just whiteboard it out and putting out responsibilities and where do they currently land and where do we have gaps. So it's not like it hasn't been a one and done as we have evolved. I suspect, 10 years from now, if you talk to me about the same subject, we will continue to be evolving what that looks like in the landscape of that. So the more it picked up steam and we started to develop, I feel like my energy in it just continued to grow. I saw that there was a need and I started to scratch the surface. And then once I did that, it was like a forest fire, right? It just kept fueling and going. So it's been amazing. And the more I think about it, and even talking to you all about it today, it excites me, right? There's so much potential. And I've seen that when there's been opportunities and vacancies in different positions to be able to bring the team together and how we not only fill maybe temporarily, but then a long-term plan in filling positions. So it's been an interesting journey that really I feel like we've just started, even though we're 2 years in.
That's incredible. Was there any sort of resistance to like redesigning an org? Your org is obviously not something that is done in haste. And obviously, from the sounds of it, you obviously put a lot of thought and care into that. But I don't know, I would think at an academic medical center, I'm curious when you brought this to leadership and get buy-in, what was that process like for you? Like what advice would you give to other leaders in your position who are maybe thinking about doing something like this, but maybe have encountered resistance with their own leadership for making changes like this?
It was not a one conversation rollout. Even when you start high level with your highest level of leadership, it was first very high level. I'll let you consume that. We're going to revisit it. We're going to come back to the table in 2 weeks, and I'm going to add another layer of what this will look like. So I didn't give the whole picture all at once, and I kept reiterating the same things. I know sometimes you have to say or hear something several times to really understand it and absorb it. So that's what I started with, is that regular conversation and going over it. Okay, so this time we talked high level. We looked at what the org chart in general would look like. Next time we're going to get into the nitty gritty of the job description, really, and what really this means and what my expectations are. Probably the biggest element that was a part of this plan, but that was a large difference, was the idea of the manager position wouldn't be static in a certain department or departments. We're planning for 2025. We're going to start looking at, is it time to move this supervisor over to this department? And that changing departments. The key is to make them more well-rounded and for them to prepare, if they're interested, to either move to that next step in their career or just make them a more well-rounded leader. If a supervisor or manager position is really where they're happy with, that's okay too. But to be a better leader, to have a better understanding of how all of patient access works, and really every single department impacts the other. Even thinking about the switchboard operator, which really feels like an island on itself, honestly, it isn't. So much of patient access is just communication and then exchange of information and how patients arrive to us and how they get to us. Even in taking on the operators, which was about the same time as I made this org structure change, that it was a new department to us, it all made sense and flowed quite well together. So I got through the management piece and really talking through it. But then you go to the supervisor level. So each level, they come from different perspectives and skill sets. So talking through that and what that will look like. And as I said, I was expanding the supervisor role. Right? I minimized the number of managers, but I expanded the supervisors. As I was recruiting, having that conversation with the applicants was critical. because this kind of structure might not be for everyone. So being very transparent, I'm a very transparent person with my team. So even in that interview process, saying, hey, this is what this looks like. We are just rolling this out. So it's what I'm sharing with you today is very high level, what this will look like and what the expectations as positions will be, but it'll be an evolution. So if that feels uneasy or not a structure that would fit for your personality and what you're looking for, understandable. So even now when we have a turnover in one of my leadership positions, that same dialogue is had at interviews, right? And making it very transparent as this is what the structure is.
And what's been the impact? So I know you said obviously that it's 2 years in the making, but now you're almost like just at the beginning. But when you think about 2-3 years ago, going back to the pandemic, hiring, all that stuff, what's sort of been the impact of this effort on your team and the departments that you are responsible for, as far as like employee morale or whatever that may be? Like, how do you think about the impact it's had?
So it has taken down some of those walls that we've had, staying within your very tight purview of what you're responsible for. And that's happening over there. That doesn't have anything to do with me, because it not only we changed the org structure, we changed jobs descriptions, but it changed our culture. That was the biggest thing. So we're not making independent decisions about each individual department within patient access. We're taking a more collaborative approach. So that's been huge. So even my team leads. So I have team leads in every area. And 2 years ago, they didn't even know who they were. If they passed each other in the hallway, they wouldn't know who the person was. Now they know each other. We meet regularly. We do education and career development activities together. And so they're more apt to pick up the phone. So as an example, I have a surgery registrar who's phenomenal, right? Has been doing it for probably 20 years, top notch. And she's very astute, right? So she's looking at notes that are put in from maybe my authorization team and now takes note, oh, you have a new insurance? I better call the authorization team, make sure they know about this because this could be impactful. So just even little things like that, and now they know those different key players and other departments across the spectrum, that has made a difference. Even I had a lead last weekend, graduated with her bachelor's degree, and all of the leads from all of the areas, the outpouring of gratitude and congratulations and kudos to this employee. 2 years ago, we didn't have that. It was all very siloed.
It's wild how much something like just a culture shift can make in terms of building high performing teams, like something like that. That's amazing. Where are you hoping that this evolves next as you're thinking about in the years to come? I know you said in 10 years it might be totally different, but just as far as the sort of team building, keeping employees engaged and promoted and happy, how are you thinking about what the next sort of phase and evolution of this might look like?
I have a lot of folks who started in my department as students, as the University of Toledo students.
Wow.
Yeah, but they get into these roles, and I have all these employees with wonderful degrees, right? Very educated folks, very intelligent, but the culture allowing them to see themselves take that next step in their career, which can sometimes be scary, I think is the piece that I'm excited for in the next 5-10 years, is to see some of those folks that maybe a couple of years ago would say, oh, I'm never leaving this job. I'm happy where I am. That's too scary. It seems like miles and miles away. I could never do that. That maybe being more engaged in this change of culture, that maybe it's more attainable, right? Maybe it's not so close off of maybe what I'm already doing, right? Lots of my team anyone can relate to this, take on leadership type qualities and roles without having the title. Right? That's one thing I would like to look towards. The second piece is looking beyond patient access. I want my team to be viewed within the organization the same way I look at them. I think because I'm the director, I'm involved in a lot of meetings and different initiatives and projects. Any organization, they all come to me, leaders within the organization. I'm hoping that this new culture and the way that I'm designing this in conjunction with my team brings credibility and trust to all of my leaders, so that when something happens within scheduling, the leaders within that department know and feel trust reaching out to my scheduling supervisor versus coming to me immediately. That's what I foresee in the future.
That's awesome. So empowering the people below you to actually make decisions without you, or feeling eroding that like hierarchy almost in some ways, where they don't necessarily need to go through you. That's very important, but also hard to do. I think sometimes it's like really hard to have that. I think everyone's worked in organizations where you're like, it's a very simple decision that should just a person can make, an employee can make, but then it's I have to go to my boss and I have to go to my boss's boss. Like 5 days later, and it's they could have just made that decision if they felt empowered. That's a hard thing to develop. So it's exciting to hear that you're thinking about that. You mentioned you want the rest of the organization to see your team how you see them. How do you see your team?
I think my team, this is probably so generic, they're rock stars. And I know probably every leader would want to get on their podium and say that. I see my management team in developing skill sets. Developing frontline staff is different than developing a leader, right? It's totally different, right? So in my management team, I see them starting to develop those skills of how do I develop the next manager, right? How do I get my supervisors to a level where if a manager position came available, we would have a pool of internal applicants to choose from. That is, I see them as developing that higher level strategy. I also want to everyone in the organization to see my leaders as consistent, right? And the same kind of reputation I've attempted to build for the entire department, to see it's not about me. I'm not the one doing all this, right? That it's my leadership team too. It's my frontline team that when you come with a concern or a workflow maybe that needs to be tweaked, it's the hard work of my frontline, of my supervisors and managers. So for them to have that same trust that they will get things done and follow up and be a partner and collaborative in the process is how I would want everyone to see my leadership team. And I think it has started. It most definitely I see those steps and the initiation of regular touch bases and basic tricks of the trade that so many use of picking up the phone, go talk to this leader face to face. I know we're all dealing with that, especially coming out of the pandemic and the virtual age that we live in, and how building those relationships are so critical. So I see those relationships starting to happen already. And I just want to see that continue to grow so that trust is there.
Oh, that's wonderful. For you, as far as building teams and thinking about people holistically, you mentioned too that there is an importance for diversity on building teams. And I'd love to just hear about how you would encourage other leaders to think about that. Like, how do they think about what diversity within a team means, and as far as building your bench and things like that? Because I know what everyone says it's important, but then putting it into practice is actually probably quite hard. It's probably a very another thing in reality. And so I'd like to hear how you approach that building teams.
Absolutely. So I see it as two prongs. So one is when you're hiring from outside, right? Let's say you don't have an internal pool to choose from and you're looking at applicants externally, which I've had to do over the last year for a leadership position. So you look at resumes, we've all been there, right? And someone looks good on paper, right? They check the boxes for you, right? They have the right experience. So you start pulling in those applicants for those in-person interviews, and it's tough, right? It's 30 minutes, maybe an hour of trying to figure out if they're the right fit and if they truly have the skill set to get you where you need to be. So recently when I had to fill a leadership position, it's not easy finding someone that checks all the boxes. Oh yeah, they have that nice resume that has the patient access experience and it's all nice and buttoned up. Doesn't look like that. And even if it did, doesn't mean it's the right fit for your department, even if they check all those boxes. So as I had different rounds of interviews, and one of them included staff, right? Staff interviewed the potential leader that we were going to bring in. And it was really difficult at times to communicate with the team. We're not just hiring someone who knows healthcare and knows patient access. We really want someone who fits the personality and has the same goals and aspirations that are aligned with what we want to see, the communication style and all these other things. It was really difficult. And I had a lot of folks that were a little resistant to that. Yeah, but why are we interviewing this person? Because they don't have the experience. Yeah, they're in healthcare. They've never been in patient access. So it was a struggle having that conversation and getting people to think outside the box. But I think it paid off in great dividends. Internally, I think sometimes human nature that we place folks in certain categories, right? And we don't think about an individual that could take the next step or be tasked with a project. I find that a lot of people on my team rise to the occasion when given the opportunity. And sometimes it's that one-on-one conversation. So I have a team lead that I had a conversation with before she was in the role. And I said, I see you as more than where you're at. I don't know if you see yourself that way, but I do. And we had a conversation about the team lead role and what that would look like. And do you really think I have that skill set? And taking a different approach of, oh, I posted, they didn't apply. Oh, wow. And seeing something in an individual that maybe they don't see themselves. And to be honest, when I first came to UTMC 9 years ago, this same employee that's now my team lead, I would have never guessed 9 years later she would be in the role that she's in. Honestly, I didn't see that in her, and I put her in a category and left her there. And to be honest, my own growth in my career and my mindset is you have to look beyond those people the staff who do a great job, come to work every day, work hard, never give you any grief, right? They never call in sick. They never make a mistake. Those people are great, and you need those people. Don't overlook the people who sometimes challenge you. That's not a bad thing. And that is so hard. That is so difficult. I see that even today, every day. Removing that emotion, right? And let's get down to the base of what this person brings to the table. And let's just appreciate that and work on skill sets, how to get over maybe some of the personality traits that are difficult for you to manage. That's the big, and it's difficult. And every day you have to check yourself. Am I making this assumption about this person because of things I really shouldn't be? So like you said, everyone talks about it. It's so important, but putting it into practice, it is putting aside some of your own views about your employees and assumptions maybe you've made and finding the true talent within them. And how can you pull that out? It's not easy. It certainly hasn't been easy for me.
So I want to ask too, because first of all, that's an incredible story. This one specific employee that you knew 9 years ago, they obviously personally grew, professionally grew, you professionally grew, but like how, because I think sometimes it's hard when you know someone for that long, you always see them as that. It's hard to see someone for who they are in like who they are now versus who they were then. I think just that is, even just like personally, friends, family, we all grow and change, and it's hard to not look at someone and see that person 20 years ago that you knew that was a knucklehead, for instance. Maybe they've grown up and matured and that whole thing. So I'd love to hear from you, how were you able to, like, how were you as a leader? How were you able to get over that bias that you may have had for that person to be able to see something in them that might not have been there before?
One thing I've worked on that I think has made a big difference with this is my listening skills. So spending more time listening to the team and individuals, making a point to talk to individuals one-on-one and listen to them. I try to solve anything for them when you have that conversation and I'm struggling with this relationship with my peer, or maybe my relationship with my manager, right? Not to interject to try and fix, to sit back and listen and take it all in. That was my number one change I had to work on. And once I started doing more listening than talking and trying to fix the problem, that's when I started to see a different side of my staff. That's what I would contribute, number one. That's how I made any kind of movement. get past categorizing people in certain ways and not looking at them as future leaders in my department. So if you can work on listening, get your notebook when you're having that one-on-one conversation with that employee and spend more time listening and writing, taking notes of what they're saying and less time talking. Give yourself time to reflect, right? Take in that conversation before you react to anything or take action. Once I started doing that, I saw a change in myself and I saw a change in my relationship with my team.
Oh, that's such great advice. Listen before you talk. We've all had employees where like you're just waiting to hear yourself talk. And I personally don't like those employees. It's so refreshing to hear. Listen before you talk is, I think, just fantastic advice for anyone in any professional setting. Very underrated. The hard skill, but a very underrated one.
Yeah, it was for me. I wanted to fix everything. I have a solution for this, or I can give an explanation for that. Not about that right now. It's about just listening.
What are some of the other things that you're working on that have allowed you to level up as a leader within your organization? Obviously, listening is one of them, but I'm curious, are there other skills and things that you've worked on over the years to get where you're at now?
Where I've worked on personally
or professionally? Yeah, both, either.
So develop this concept that I've been working on within my own department of recent, and I say recent, like maybe within the last year, I started thinking about it more organized. And how do we develop a different culture, leader to leader, across the organization? So that idea, I started with a little group of my peers, fellow directors, to pitch an idea. I said, hey, whether you were promoted internally into a leadership role or you came in from the outside, I had a variety. One individual new to the organization, new to a leadership type role. So I had different perspectives. Some people had been here a while. And how do I take that idea of the culture I wanted to create and that growth, and how could we do something on a larger scale? So I started was drinks after work, brainstorming this idea over drinks and pizza. And so we started developing this leadership group. And so now we have this leadership group that meets regularly, and we do all things from volunteer work to education. I think we meet next week. We're going to discuss patient needs and put some organization around patient needs and how to source patient needs and get patients what they need for whatever they're lacking. So for me personally, I've seen that growth and coming to the table with the executive team and again, being very honest and transparent and saying, hey, we want to develop this leadership group, but you're not invited to the executive team. And the CEO said to me, Laura, can I come check it out and what y'all are talking about? And I said, respectfully, no. I said, it's not my group. It's a group led by my fellow leaders. If the group would want to invite executives to the table, then yeah. But right now, this is a leader group. So what's come out of it has been fantastic. And I feel as though it has grown even myself significantly because it's no longer just thinking about what's best for my bubble, right? And trying to develop my bubble, but we can only be successful as the whole, right? We're limited on the success we can have within patient access if we don't have that same culture across the organization. My personal growth has been looking beyond my four walls and developing not just my personal relationship with a fellow leader. That's a piece of it, right? And that's important that you develop relationships, but it's across the spectrum and how do we come together? So it's, again, that those conversations started like a year ago. Those roots conversations to where we are now, it's still just in its infancy, kind of developing. But that has been of recent my biggest area of growth is taking, again, and what I'm aspire to is having more of that operational view on things and taking strategy from a higher level, which is, again, it's not easy to take yourself out of the weeds a little bit. And how do we do this in a way where everyone has a voice at the table? So that's been interesting and fun, a lot of fun.
I think too, surrounding yourself with other great people makes a difference, right? It's like, I think some of the best teams I've ever been on are when you look around, you're like, oh my God, everyone here is an A player. I cannot drop the ball. And so I think just surrounding yourself, even if it's a small group that is officially sanctioned by an executive, does make a difference as far as like leveling up. I'm curious, do you think inviting the executives to that, do you think it would taint the group in any way?
It
Or
would
what,
change, yeah, it would change the dynamic for sure.
Yeah.
And sometimes when we had one just the other day, a think tank, right? So we're just spitfiring ideas and throwing things out there. And I think adding an executive to that may, for some folks, you might create a pause before you would share something. So yeah, I think that was important to this group.
Yeah, it's incredible. I want to be cognizant of our time together. I feel like I could talk to you forever. We might need to do the part 2 in 10 years for sure.
It would be fun, wouldn't it?
It would be. So Laura, for you personally, what's the hardest thing just working in a revenue cycle?
Revenue cycle. So
Or patient access? I mean, I
yeah,
guess just about patient access specifically.
whenever you're asked, what do you do? Laura, what do you do at the hospital? Most, even folks within the hospital do not, unless you're in revenue cycle, they don't understand it. I know it's there. I know it exists. I know you're doing important things so that we get paid. No idea what it's all about. And when I talk to people outside of healthcare, just multiply that exponentially. I have no idea what any of those words mean. So usually I just say, I work in finance. It's fine. And then, oh, okay. Then there's a sense of reference. Oh, money. I get it. So I feel like revenue cycle is this very unique type of business. It's not your standard transaction, right? It's not going to a store. It's not paying for a service in your traditional. So having that understanding, even within the healthcare system, when you're talking to a nursing director or a lab manager, can sometimes be difficult, right? And then one of the greatest struggles in, I would say, patient access, what the hot topics you hear about estimates. We've been in it for a little while, so it's starting to get maybe a little bit easier, but it's still not easy, in my opinion. Access is a major pain point. And then prior authorizations. I think those would probably be my top 3.
Yeah, I don't know anyone in revenue cycle who enjoys talking about prior authorizations. So that might be a whole other conversation for another day.
Absolutely.
That's great. All right, let's jump. You ready? The lightning round. Let's do it. This is my opportunity. I'm just going to ask you questions. I don't even get to respond. All right. Question 1. What's the most important metric for you that gives you the most anxiety?
I think it all boils down to quality, no matter what metric you're talking about. So when I look at whether it's departmental or individual scorecards around quality, what's hitting edits in quality work queues, everything streams down from that. So that would be my biggest metric. It's just general.
Okay. What's the biggest goal you want your team to achieve this year?
You could throw out different metrics, right? And different, whether it be collections or denials or stuff. But for me, it's personal development. That's what I want my team to work and what we're currently working on actively.
Like I'm going to break my own rule that I'm not allowed to engage in the lightning round, but I feel like when you're people managing, that's what gets the buy-in, that's what gets the trust, all of that. People development, it's so crucial. So I love hearing that. And I might have an idea what you might say, but what's something you wish more people would talk about when it comes to patient access or revenue cycles?
I wish we talked more about developing our teams across the spectrum of revenue cycle. Again, sometimes we stay very much in our categories, your patient access, your HIM, your billing, and we all interact with each other. One feeds another. It's all a circle, right? It's all a cycle. It's called revenue cycle. But do we ever talk about breaking down those job titles and job descriptions and to really understand how you might impact the other or understand what the other side of the fence is looking like? We don't do that exercise. I don't see it across the spectrum, and I don't hear people talking about it. But if there's revenue cycle leaders out there listening, as a patient access director, that's what I would like to see. I think you would enrich a team significantly by finding a mechanism to break those barriers across the departments within revenue cycle.
That's great. You heard it, audience, people listening. Let's do that. All right. And so finally, Laura, your chance. Talk about working with you and your team at University of Toledo Medical Center. Are you any current job opening? Are you hiring? Where can people go to apply or learn more? This is your just chance to hype up open jobs that you might be trying to fill.
Absolutely. So if you go to u.edu, you'll find a careers tab at the top of the page for all of our open positions. Currently, I'm recruiting for general registration. I have a telephone operator position. I have an inpatient admitting and authorization position available, and emergency department positions that are open. So I might have a position also in my call center also that's available. So the nice variety that we have open, but also we offer some opportunities for work from home for those of folks out there listening that might be interested in that setup. So my outpatient authorization and my call center that operates 24/7 that does scheduling and pre-registration all work remotely. We started that during the pandemic and found such great returns on that, not only from a cultural standpoint, but honestly, dollars and cents as well. So I think we have the ability to offer a wide spectrum of different types of positions in different environments within patient access, which I think is, if you look at revenue cycle in general, I think that's pretty unique for patient access to have that maybe billing departments and coding departments don't have. So if you like the hustle and bustle of fast-paced emergency room, you have that. And if you like the kind of quiet working alone type responsibilities, we have that too. So I like the variety that we offer. And as I've shared before, the team and the culture that we're creating, if you like being engaged and involved and you want to be able to develop yourself and have education and have opportunities for career growth, that is our priority and my leadership team. So if that sounds like something that fits you, I would encourage anyone listening to go to utoledo.edu. Check it out.
It's great. All right. And finally, Laura, first, thank you. This has been a fantastic conversation. So I just want to personally thank you for making the time I feel like I learned a ton. Where can listeners go if they want to connect with you or learn more? Are you on LinkedIn, TikTok, Instagram? Where do you hang out these days in a online setting?
LinkedIn is your best bet. Although I know there's definitely lots of social platforms out there. The best way to find me is LinkedIn.
Awesome. All right. Hey, Laura, thanks so much for making the time. I appreciate it. This has been a fantastic conversation. So thank you.
Thank you so much, James.